this week's Wellness Wednesday, we are talking about Black maternal health. According to the New York State Health Department, Black women in New York State are 5 times more likely to die from pregnancy-related complications than white women. For a closer look at this important topic, we're joined by Dr. Thomasena Ellison. She is the Associate Director of Gynecology at Maimonides Health over in Brooklyn. Great to have you with us this afternoon.
Thank you for having me.
Topic, we do appreciate it. When you hear that stat about black mortality rates among women, how does that hit you as a healthcare provider, someone who is there to save lives?
It hits me hard as a healthcare provider. It hits me hard as a woman of color. It hits me hard as a mother of a daughter. It hits me hard as someone who's given birth. That why are we here in 2026? So there's many facets and many ways that it hits me very difficult. It's very, very sad. But I can say we are moving forward, and we have taken positive steps to alleviate this and make it better.
Before we talk about what's being done to make it better, talk to us about the contributing factors. Why does this still exist today?
Systemic racism still exists today. And we know that people of color, ethnically and racially minority, marginalized people have worse outcomes who happen to have darker skin colors.
And we're talking about access to health care, to insurance, the way they're treated when they go into a doctor's office, all of that?
Yes, also lines of communication, being comfortable expressing your concerns and needs, having access to health care prior to getting pregnant and preparing for pregnancy, planning for your pregnancy as opposed to pregnancy planning you, being able to see the doctor, speak to the doctor, understanding the dialect that the person is speaking, the doctor travels with that. So it's many things.
Knowledge is power, as you know, right? What should women know? What should they understand when they are going into a doctor's office? What are the things they should keep in mind in terms of the information they should be getting?
There's lots of sources of information. That's what they should keep in mind.
Yeah.
Don't be afraid to reach out and ask. Don't be afraid to ask the question again. Don't be afraid to ask someone else the question, right? That the answers are there, just go out and to seek them.
Yeah. Talk about the importance of health screenings when it comes to high blood pressure, diabetes, that information, not just important for pregnant women, but everybody.
Well, the ideal situation in any woman who wants to be pregnant, to give birth, to be a parent, is to prepare for that. Seek out your primary care doctor, know about your high blood pressure, know that it's there, know how to treat it, know about your diabetes, ideal body weight, your diet. Prepare for your pregnancy so that when the pregnancy comes, you're in optimal condition to be pregnant and to give birth.
Talk to us what's being done now, the progress being made not only at Maimonides, but in general. What are we seeing today to alleviate these issues?
Well, from the state level to the city level to the individual hospital level, such as Maimonides, who has elevated primary care to be the forefront of our care so that these women who choose to get pregnant will be in the best of care. Our state level, our city level have put in programs to take care of women who unfortunately didn't have the opportunity to seek primary care before getting pregnant and to address their individual needs, to come to them, to be culturally competent care for these women, which is well beyond just skin color. It's understanding what their culture is so that we can optimize their care during their pregnancies.
Well said, Dr. Thomasena Ellison from Maimonides. Great to talk to you this afternoon. Appreciate it.
Thank you for having me.